100 past papers MCQs, with answers on topic, patient counseling and drug dispensing, in subject clinical pharmacy. We are sharing questions and the direct answers to save your time. General syllabus has been given in our video, A1, uploaded at our YouTube channel, Pharmacy Jobs and MCQs. Patient counseling and drug dispensing. 1. Question: what is the best way to counsel a patient on metered dose inhaler use? Answer: shake well before use, exhale fully, then inhale slowly and deeply. 2. Question: how should a pharmacist counsel a patient on the use of sublingual nitroglycerin? Answer: place the tablet under the tongue and let it dissolve without swallowing. 3. Question: what advice should be given to a patient taking warfarin? Answer: avoid foods high in vitamin K like green leafy vegetables. 4. Question: what should a pharmacist emphasize when counseling on antibiotics? Answer: complete the full course of therapy even if symptoms improve. 5. Question: how should a pharmacist counsel a patient taking metformin? Answer: take with food to minimize gastrointestinal side effects. 6. Question: what is the key counseling point for patients using insulin? Answer: rotate injection sites to prevent lipodystrophy. 7. Question: how should a pharmacist advise a patient on missed doses of oral contraceptives? Answer: follow the specific instructions in the package insert for missed doses. 8. Question: what should a pharmacist tell a patient using topical corticosteroids? Answer: apply a thin layer to the affected area and avoid long-term use on the face. 9. Question: how should a pharmacist counsel a patient taking statins? Answer: report any unexplained muscle pain or weakness to your doctor. 10. Question: what is the correct counseling for a patient using albuterol inhalers? Answer: use albuterol as needed for acute symptoms, but not more than prescribed. 11. Question: how should a pharmacist counsel a patient on taking bisphosphonates? Answer: take with a full glass of water, and remain upright for at least 30 minutes after. 12. Question: what should a pharmacist emphasize when dispensing levothyroxine? Answer: take on an empty stomach, 30 to 60 minutes before breakfast. 13. Question: how should a pharmacist counsel a patient on opioid use? Answer: discuss the risk of addiction and the need for careful dose management. 14. Question: what is the key counseling point for patients on antihistamines? Answer: be aware of drowsiness, especially with first-generation antihistamines. 15. Question: how should a pharmacist advise a patient on the use of eye drops? Answer: wait at least 5 minutes between administering different eye drops. 16. Question: what should a pharmacist explain to a patient using nasal sprays? Answer: prime the spray before first use and avoid blowing your nose immediately afterward. 17. Question: how should a pharmacist counsel a patient on taking NSAIDs? Answer: take with food to reduce the risk of stomach irritation. 18. Question: what is the key counseling point for patients using transdermal patches? Answer: apply the patch to a clean, dry, and hairless area, and rotate the site of application. 19. Question: How should a pharmacist advise a patient on taking antidepressants? Answer: it may take several weeks to notice an improvement in symptoms. 20. Question: what is the correct counseling for a patient using rectal suppositories? Answer: insert with the pointed end first and remain lying down for a few minutes. 21. Question: how should a pharmacist counsel a patient taking ACE inhibitors? Answer: monitor blood pressure regularly and report any persistent cough. 22. Question: what should be explained when dispensing extended-release medications? Answer: do not crush or chew the tablets. Swallow them whole. 23. Question: how should a pharmacist counsel a patient using insulin pens? Answer: prime the pen before each injection, and use a new needle each time. 24. Question: what is the key counseling point for patients using topical antifungals? Answer: continue using the medication for the full duration, even if symptoms improve. 25. Question: how should a pharmacist advise a patient on storing nitroglycerin tablets? Answer: keep in the original container and tightly close it after each use. 26. Question: what should a pharmacist explain to a patient using inhaled corticosteroids? Answer: rinse your mouth after each use to prevent oral thrush. 27. Question: how should a pharmacist counsel a patient on taking anti-epileptics? Answer: do not stop the medication abruptly. Consult your doctor first. 28. Question: what should be included in counseling for patients taking beta blockers? Answer: the medication may cause fatigue initially, but this usually improves over time. 29. Question: how should a pharmacist advise a patient on the use of sublingual tablets? Answer: place the tablet under the tongue and allow it to dissolve completely. 30. Question: what is important to explain to a patient using a peak flow meter? Answer: use it daily to monitor asthma control and adjust medications accordingly. 31. Question: how should a pharmacist counsel a patient on the use of oral corticosteroids? Answer: do not stop the medication abruptly, as tapering may be necessary. 32. Question: what should be emphasized when dispensing oral contraceptives? Answer: take at the same time each day for maximum effectiveness. 33. Question: how should a pharmacist advise a patient on the use of antihypertensive medications? Answer: monitor blood pressure regularly and adhere to the prescribed regimen. 34. Question: what is important to explain about proton pump inhibitors (PPIs)? Answer: take 30 minutes before meals for optimal effect. 35. Question: how should a pharmacist counsel a patient on the use of eye ointments? Answer: use after eye drops if both are prescribed, and expect temporary blurred vision. 36. Question: what should be included in counseling for patients taking antacids? Answer: take antacids at least 2 hours apart from other medications to avoid interactions. 37. Question: how should a pharmacist advise a patient on the use of diuretics? Answer: take in the morning to avoid frequent nighttime urination. 38. Question: what is the key counseling point for patients on anticoagulants? Answer: monitor for signs of bleeding and avoid activities that could cause injury. 39. Question: how should a pharmacist counsel a patient taking anti-hyperlipidemics? Answer: follow a heart-healthy diet in addition to taking the medication. 40. Question: what should be emphasized when dispensing bronchodilators? Answer: use as needed for shortness of breath, but do not exceed the prescribed dose. 41. Question: how should a pharmacist counsel a patient on proper inhaler technique? Answer: exhale fully before using the inhaler, and inhale slowly and deeply while pressing the canister. 42. Question: what is important to explain to patients using bisphosphonates for osteoporosis? Answer: remain upright for at least 30 minutes after taking the dose to prevent esophageal irritation. 43. Question: how should a pharmacist advise a patient on the use of calcium supplements? Answer: take with food to enhance absorption, but avoid taking with iron supplements. 44. Question: what should be emphasized when dispensing opioids for pain management? Answer: use the lowest effective dose for the shortest duration possible to avoid dependency. 45. Question: how should a pharmacist counsel a patient using topical NSAIDs? Answer: apply a thin layer to the affected area and avoid using on broken skin. 46. Question: what is the key counseling point for patients taking SSRIs? Answer: it may take several weeks to notice improvements in mood. 47. Question: how should a pharmacist advise a patient on the use of nicotine replacement therapy? Answer: start using the product as soon as you quit smoking, and follow the recommended schedule. 48. Question: what should a pharmacist explain about over-the-counter cold medications? Answer: avoid using multiple products with the same active ingredient to prevent overdosing. 49. Question: how should a pharmacist counsel a patient on drug-induced photosensitivity? Answer: use sunscreen and wear protective clothing when exposed to sunlight. 50. Question: what is important to explain to patients using immunosuppressants? Answer: take the medication exactly as prescribed, and avoid missing doses. 51. Question: how should a pharmacist counsel a patient using a nasal spray? Answer: prime the spray before first use and avoid sniffing hard after spraying. 52. Question: what should be emphasized when counseling on the use of corticosteroid inhalers? Answer: rinse mouth after use to prevent oral thrush. 53. Question: how should a pharmacist counsel a patient taking antipsychotics? Answer: discuss the potential for weight gain and monitoring of blood glucose. 54. Question: what should be advised to a patient using eye drops for glaucoma? Answer: wait at least 5 minutes between different eye medications. 55. Question: how should a pharmacist counsel a patient on the use of oral antifungal medications? Answer: continue taking the medication for the full prescribed duration even if symptoms improve. 56. Question: what is a key counseling point for a patient taking SSRIs? Answer: it may take several weeks to feel the full effect of the medication. 57. Question: how should a pharmacist counsel a patient on drug-induced photosensitivity? Answer: advise using sunscreen and wearing protective clothing when outdoors. 58. Question: what is a critical counseling point for patients using lithium? Answer: maintain adequate hydration and regular blood level monitoring. 59. Question: what should a pharmacist emphasize when dispensing medications for tuberculosis? Answer: adherence to the full treatment regimen is essential to avoid resistance. 60. Question: how should a pharmacist counsel a patient taking proton pump inhibitors (PPIs)? Answer: take the medication 30 minutes before meals for optimal effect. 61. Question: what should be included in counseling for patients on thyroid hormone replacement therapy? Answer: take the medication on an empty stomach, preferably in the morning, 30 to 60 minutes before breakfast. 62. Question: how should a pharmacist advise a patient on the use of iron supplements? Answer: take with vitamin C or orange juice to enhance absorption, but avoid taking with dairy products. 63. Question: what is a key counseling point for patients using orlistat for weight loss? Answer: take with meals containing fat, and be aware of potential gastrointestinal side effects. 64. Question: how should a pharmacist counsel a patient on the use of proton pump inhibitors (PPIs)? Answer: take 30 minutes before meals for the best effect, and do not crush or chew the tablets. 65. Question: what should a pharmacist advise a patient using oral contraceptives who misses a dose? Answer: follow the package insert instructions for missed doses and use backup contraception if necessary. 66. Question: how should a pharmacist counsel a patient using transdermal nicotine patches? Answer: apply the patch to clean, dry skin, rotate sites daily, and remove before bed if it causes sleep disturbances. 67. Question: what is a key counseling point for patients taking anti-diabetic medications? Answer: monitor blood sugar levels regularly and report any signs of hypoglycemia, such as dizziness or sweating. 68. Question: how should a pharmacist advise a patient on the use of oral anticoagulants? Answer: monitor for signs of bleeding, avoid NSAIDs, and keep a consistent intake of vitamin K. 69. Question: what should a pharmacist emphasize when counseling on benzodiazepines? Answer: use only as prescribed, avoid alcohol, and do not abruptly stop the medication without consulting a doctor. 70. Question: how should a pharmacist counsel a patient on using sublingual nitroglycerin for angina? Answer: take 1 tablet under the tongue at the onset of chest pain, and seek emergency help if pain persists after 3 doses. 71. Question: what is the correct advice for patients using oral corticosteroids? Answer: take with food to prevent gastrointestinal irritation, and do not stop abruptly. 72. Question: how should a pharmacist counsel a patient on taking methotrexate for rheumatoid arthritis? Answer: take the medication once weekly, not daily, and be aware of the need for regular blood tests. 73. Question: what is a key counseling point for patients using antipsychotic medications? Answer: monitor for side effects like weight gain, and report any movement disorders to your doctor. 74. Question: how should a pharmacist advise a patient on the use of bisphosphonates? Answer. Take with a full glass of water, remain upright for 30 minutes, and avoid food for at least 30 minutes after taking. 75. Question. What should a pharmacist explain when dispensing antibiotics? Answer. Complete the full course even if symptoms improve to prevent resistance. 76. Question. How should a pharmacist counsel a patient using inhaled corticosteroids for asthma? Answer. Rinse your mouth after use to prevent fungal infections. Oral thrush. 77. Question. What is the key advice for patients using opioids for pain management? Answer. Use the lowest effective dose, avoid alcohol, and be aware of the risk of dependency. 78. Question. How should a pharmacist counsel a patient on taking calcium supplements? Answer. Take with food, and avoid taking with iron supplements at the same time. 79. Question. What should be emphasized when counseling patients on the use of anticholinergic medications? Answer. Be aware of side effects like dry mouth, constipation, and urinary retention. 80. Question. How should a pharmacist counsel a patient on the use of antihypertensive medications? Answer. Adherence to medication is crucial, and blood pressure should be monitored regularly. 81. Question. What is the key counseling point for patients using long-term NSAIDs? Answer. Take with food to minimize gastrointestinal irritation, and report any signs of bleeding or ulceration. 82. Question. How should a pharmacist counsel a patient using nasal decongestant sprays? Answer. Limit use to 3 to 5 days to avoid rebound congestion. 83. Question. What should a pharmacist explain when dispensing statins? Answer. Report any unexplained muscle pain, and avoid grapefruit juice as it can interfere with the medication. 84. Question. How should a pharmacist counsel a patient on the use of eye drops for glaucoma? Answer. Wait at least 5 minutes between different eye medications, and apply pressure to the inner corner of the eye for 1 minute after instilling the drops. 85. Question. What is a key counseling point for patients taking antihistamines? Answer. First-generation antihistamines may cause drowsiness. Avoid driving or operating machinery until you know how the medication affects you. 86. Question. How should a pharmacist advise a patient on the use of nicotine gum for smoking cessation? Answer. Chew slowly until you feel a tingling sensation, then park the gum between your cheek and gums. 87. Question. What should a pharmacist emphasize when dispensing immunosuppressant medications? Answer. Take exactly as prescribed, and do not miss doses to avoid rejection of transplanted organs. 88. Question. How should a pharmacist counsel a patient on the use of laxatives? Answer. Use only as needed, and avoid overuse, which can lead to dependency or electrolyte imbalances. 89. Question. What is the key advice for patients using bronchodilators? Answer. Use as needed for shortness of breath, but avoid overuse, which can lead to side effects like rapid heart rate. 90. Question. How should a pharmacist counsel a patient taking fluoroquinolones? Answer. Avoid taking with dairy products or calcium-fortified foods, and report any tendon pain or swelling. 91. Question. What should a pharmacist explain when dispensing hormonal replacement therapy (HRT)? Answer. Discuss potential risks, such as blood clots, and monitor for signs of breast tenderness or swelling. 92. Question. How should a pharmacist counsel a patient on the use of antacids? Answer. Take at least 2 hours apart from other medications to prevent interactions. 93. Question. What is the key counseling point for patients using transdermal hormone patches? Answer. Apply to clean, dry skin, rotate the application site, and avoid using the same site twice in a row. 94. Question. How should a pharmacist advise a patient on the use of sleep aids like Zolpidem? Answer. Use only as prescribed, and avoid alcohol and activities that require full alertness, such as driving. 95. Question. What should a pharmacist emphasize when dispensing medications for bipolar disorder? Answer. Adherence to therapy is crucial, and regular monitoring of blood levels may be necessary. 96. Question. How should a pharmacist counsel a patient taking anti-hyperlipidemics? Answer. Follow a heart-healthy diet in addition to taking the medication, and report any muscle pain or weakness. 97. Question. What is the key counseling point for patients using proton pump inhibitors (PPIs)? Answer. Take 30 minutes before meals, and avoid long-term use without consulting a healthcare provider. 98. Question. How should a pharmacist advise a patient on taking anti-epileptics? Answer. Do not stop the medication abruptly without consulting a doctor, as it may lead to seizures. 99. Question. What should be explained when dispensing antidepressants like SSRIs? Answer. It may take several weeks to notice an improvement in mood, and do not stop taking the medication suddenly. 100. Question. How should a pharmacist counsel a patient on the use of fentanyl patches? Answer. Apply to clean, dry skin, rotate sites, and avoid heat sources that can increase absorption and lead to overdose. Regards. To get more, contact us. Majid Body Advocate, LLB, PhD Scholar, Pharmaceutics 2023-2026. Vice President, Pakistan Pharmacist Association PPA Punjab, Pakistan. +92 321 404 2036. Thank you.